Today we will talk about the pneumonia. Pneumonia is basically a serious lung infection in which you will see the inflammation in the alveoli, or you can say air sacs, in one or both lungs. After that, you will see the filling of the alveoli by the fluid or pus. This is life-threatening conditions in infants and elderly individuals and in people with weakened immune system. Next, we will talk about the causes. So there are a lot of causes of the pneumonia: bacterial pneumonia, viral pneumonia, fungal pneumonia, and aspiration pneumonia. So in the bacterial pneumonia, that cause will be the bacteria. So most important bacteria is the Streptococcus pneumoniae, or you can say pneumococcus. Other bacteria like Haemophilus influenza and Mycoplasma pneumoniae. But keep remember, bacterial pneumonia often occurs after a viral respiratory infections like influenza. Next is the viral pneumonia. Cause will be the virus, in which you will see the different viruses like influenza virus, respiratory syncytial virus, SARS-CoV-2, severe acute respiratory syndrome coronavirus 2. That is also the cause of the COVID-19, can also cause the pneumonia. Viral pneumonia is generally milder than the bacterial pneumonia. Next is the fungal pneumonia is common in the immunocompromised patients, and the cause will be the fungus, different fungus like Histoplasma coccidioides and pneumocystic gyrovicii, mostly seen in immunocompromised patients. Aspiration pneumonia, when the food, drinks, vomiting, or the saliva enters in the lungs through the trachea, then these things will retain inside the lung, and ultimately you will see the infection happenings at that site due to the presence of these things in our lung. So that is actually the aspiration pneumonia. And this is mostly seen in an individual with facing swallowing difficulties or neurological disorders patients. So these are the different causes of the pneumonia: bacterial, viral, fungal, and aspiration pneumonia. Next, we will talk about the symptoms. Common symptoms and the severe symptoms. Common symptoms like fever, chills, and the sweating. Cough with phlegm or pus. Shortness of breath, chest pain that worsens with breathing or during the coughing, fatigue, and the weakness. These are the common symptoms in the pneumonia. Next is the severe symptoms like confusion or delirium, commonly seen in elder. Bluish lips or fingertips due to lack of oxygen, because this is actually the infections of the lungs, and most probably the exchange of the oxygen will also reduce in the pneumonia. High fever with shaking, chills, and rapid breathing or heart rate. Next, how I will diagnose the pneumonia? So we can listen the lung sound by using this stethoscope to detect the crackles or abnormal breathing sounds. That is the physical examination. Next is the imaging test, that will be the X-ray or the CT scan. In X-ray, we can identify the inflammations or the fluid, and CT scan will give you the more details of the lungs in that case. Laboratory test, you can go towards the blood test that can detect the infections. Sputum culture, we can culture the sputum, so that will be easier for the identification of the specific cause of the pneumonia by doing the sputum test. A pulse oximetry measures the oxygen levels in our blood. So these are basically the three important: physical, imaging, and the laboratory test for the diagnosis of the pneumonia. Next, we will talk about the treatment. Bacterial pneumonia obviously will be treated by the antibiotics like amoxicillin, azithromycin, and levofloxacin. And symptoms can improve within a day, but full recovery will obviously take some week. Viral pneumonia caused by the antiviral medications like oseltamivir for influenza. And you will also give the supportive therapy, in that case, rest, fluid, and fever reducing medications like the acetaminophen. Fungal pneumonia treatment, that will be treated by the antifungal medication fluconazole and amphotericin B. Hospitalization or severe cases require hospitalization, oxygen therapy, mechanical ventilation. So these things will be available in the hospital. So final decision will be made by your local physicians about the treatment of the uh, pneumonia. Next, how we will prevent the pneumonia? Through vaccination, healthy lifestyles, and protecting high-risk individuals. Vaccination, pneumococcal vaccine. This is the most important and the most common vaccine, like PCV13, PPSV23, help prevent the Streptococcus pneumonia. Influenza vaccine, that relates to the flu-related pneumonia. COVID-19 vaccine also reduce the risk of the viral pneumonia. Healthy lifestyle like good hygiene, hand washing regularly helps prevent infections, and no smoking, that because smoking actually damages the defense system of our lung. Next is the healthy diet or exercise that strengthens our immune system. Next, avoiding close contact with sick individuals and wearing masks in crowded places during flu seasons. So these are the important preventive measures regarding the pneumonia. So this is all about the pneumonia. If you still have any question, you may ask in the comment section. Thank you so much.